Normal breathing, called eupnea, is quiet, effortless, and rhythmic at rest. In healthy adults, the respiratory rate ranges from 12 to 20 breaths per minute, with a tidal volume of about 500 milliliters in men and 400 milliliters in women. The respiratory rate in children is typically higher and varies by age. Tachypnea is rapid, shallow breathing. It can be physiological, such as during exercise or pregnancy, or pathological as a result of anxiety, metabolic acidosis, sepsis, or pulmonary or cardiovascular conditions. Hyperpnea refers to an increase in depth and often rate of breathing to match a higher metabolic demand. Hyperpnea is physiological with normal blood gas values. Hyperventilation, on the other hand, is deep and rapid breathing that persists beyond metabolic requirements, causing low blood carbon dioxide, hypocapnia, and respiratory alkalosis. Common triggers include anxiety, panic attacks, pain, fever, and metabolic acidosis. Kussmaul respiration, a type of hyperventilation, is a deep, rapid, and labored breathing pattern associated with severe metabolic acidosis. It reflects the body's attempt to exhale more carbon dioxide to reduce blood acidity. Kussmaul breathing is most often triggered by diabetic ketoacidosis and renal failure. Bradypnea refers to a slower than normal breathing rate. It may result from drug or alcohol use, hypothyroidism, or traumatic brain injury. Blood gas can remain normal at first. Hypoventilation is shallow, irregular, or slow breathing that leads to low blood oxygen, hypoxemia, and high blood carbon dioxide, hypercapnia. Common causes include respiratory diseases such as COPD, central nervous system depression, drug use, and neuromuscular disorders that affect respiratory muscles. Apnea refers to periods of cessation of breathing. Apnea can be central or obstructive. Obstructive apnea is caused by physical obstructions in the airways, while central apnea is when the respiratory centers in the brainstem fail to initiate respiration. During sleep, central apnea typically occurs when carbon dioxide levels in the blood drops below a certain point, called the apnea threshold, and the brain suppresses respiration to maintain blood gas balance. Severe heart failure or stroke may cause Cheyne-Stokes respiration. This pattern is characterized by regular cycles of crescendo-decrescendo breathing, alternating with periods of apnea. Because heart failure patients tend to hyperventilate to compensate for the low oxygen levels supplied by the failing heart, they maintain a lower carbon dioxide baseline, closer to the apnea threshold. Thus, even a slight increase in ventilation in these patients can drive carbon dioxide level below the threshold and trigger apnea. Brain injuries from stroke, trauma, and certain drugs can impair central respiratory control and result in abnormal breathing patterns. Examples include cluster respiration, composed of clusters of breaths followed by variable episodes of apnea; ataxic breathing, a chaotic breathing pattern with irregularity in rate, depth, as well as timing and duration of apnea; and apneustic breathing, which consists of prolonged, gasping inspirations followed by brief, inadequate expirations.
Are you a fan of Alila Medical videos? If so, you will love our new Alila Academy. Based entirely on our highly effective animated mini lectures, our courses are designed to follow a typical syllabus in each subject. Each topic is extensively illustrated and comes with quizzes to test your understanding, downloadable PDFs for a quick review, as well as images for you to use in school projects or presentations. We are known for producing highly effective animated videos that explain the most difficult concepts in record time. We have no doubt that our courses will be a lifesaver for both students and teachers alike, so do come check them out. Alila Academy. Clear, concise, effective, with extensive visual resource. No one explains like Alila does.